So problems can emerge in a variety of different ways, and we at Equanimity specialise in emotional problems. Problems to do with our mood, problems to do with anxiety, depression, but also habits. So depression can manifest in a variety of different ways. The main characteristics are depressed or irritable mood or loss of pleasure, but depressive conditions can also manifest in loss of energy, sleep problems and appetite problems. The classic condition related to depression is major depressive disorder, whereby people have repeated episodes of depression with sort of marked mood problems with all sorts of other problems alongside it. Usually these mood episodes will persist for at least a couple of weeks, but often for longer. Some people have what is referred to as persistent depressive disorder, also has been referred to as dysthymia, whereby people have a chronic course, a long-standing course of depression, which goes on for years in many cases. A lot of people with persistent depressive disorder often even forget what it was like to be happy, what it was like to feel joy. And more recently, premenstrual dysphoric disorder, which has been recognised in the last few years, whereby mood disturbance occurs sometime around ovulation and remits sort of a few days after menses. This can affect quite a few women in society. Anxiety conditions are also common and can manifest in a variety of different ways. They will involve fear, anxiety, and a variety of other symptoms alongside it. One of the most common anxiety conditions is social anxiety disorder, a condition whereby people often feel fearful and anxious in social or performance situations, and usually will feel judged and scrutinised. For many people, they may avoid social situations as a result of it, and it can be quite a crippling problem for many people. However, panic disorder is another condition that often comes up, and panic disorder essentially is repeated episodes of panic. So that would be sort of intense fear, anxiety that comes out of the blue, often alongside a sense of doom, but also what we refer to as peripheral symptoms, where we may feel shaky, we might notice a heart racing, might get hot and sweaty. Agoraphobia can manifest, and a lot of people with panic disorder go on to develop agoraphobia. And this is a condition whereby people going into public spaces, let's say shopping malls, going on public transport, can become very, very anxious, can feel very, very bad in these sorts of situations, and usually want to escape from the situation they're in. For some people it can be so bad that they become housebound. Specific phobias can also emerge, and people may have a phobia of, let's say, flying or heights, or particular animals. And for some people this can be very, very problematic. Fears of spiders are very, very common, for example. But generalized anxiety disorder is another condition that can manifest, and it occurs when people have frequent worries throughout the day. They are persistent worries, and they concern a variety of different activities and events. It could be worries about the health of family members. It could be worries about finances, about work. People with generalized anxiety disorder have a problem stopping the worry, and often feel physical symptoms alongside it, such as tension, such as sleeplessness. Separation anxiety disorder is another condition, and it often begins in childhood but can also manifest in adulthood, whereby people feel very anxious, feel very nervous when they are away from attachment figures, parents, partners, but also away from home, and people can feel very, very overwhelmed when this happens, and it can affect their lives significantly. Obsessive-Compulsive related disorders can also emerge. Typically, people with Obsessive-Compulsive disorder, or OCD, will have frequent unwanted thoughts. Let's say, for example, of contamination, people coming to harm, and most people with these unwanted thoughts will go on to develop habits to counter those thoughts, such as cleaning if they have contamination obsession. But also repetitive body behaviours can also manifest. So habitual hair pulling, Trichtillomania is referred to, or repeated skin picking, Excoriation disorder, are the conditions that are related to OCD, and for some people these can be very, very problematic. If you feel that you are affected by any of these conditions, we have a team of specialists who can not only recognise and diagnose the problem, but can go ahead and recommend effective treatments for all of these conditions.